we have a session which I am really interested in because, as you know, in Canada, over 50% of all the physicians, when recently surveyed, were on the verge of burnout. When you ask nurses, you get a very similar response. And another survey, which I can say is the EHR has been named as one of the reasons why they're burned out at work. So preventing burnout before it starts, using case data to drive disability management in healthcare. We have a team from Acclaim Ability Management, Jan Marie Prado, Director of Operations, Employer Services, Brianna Ali, Director of Data and Analytics, and Elena Hodge, Director of Technology. So here's the clicker. So there's chairs if you feel like you want to sit, and you can go to the podium as well.
Thanks.
You'll see your slides there.
Beautiful, thank you. Excellent. Hi, everyone. Thanks for sticking it out to the end on a stormy day, and we appreciate you being with us today. And you might wonder what burnout and data has to do with each other. We're going to walk you through that and hopefully show you how different ways data can be used in order to identify and reduce the impact of burnout on the workforce in your hospital. So we've heard a lot about how data can help patient care, how data can help in different sectors of the hospital. We focus on absences, sick leaves, and we want to show you how you can use your sick leave data to help drive programming within organizations, not just healthcare, but any organization, to avoid that burnout. So we want to do that by showing you how you can react to the information that you're gathering. And hopefully organizations are gathering information on the data that is driving sick leave programs. And we want to help support the people that are delivering care to our loved ones and help you support your employees. So we all work for Acclaim Ability Management. We're an ability management company, or as other organizations say, a disability management company. We focus on helping employers across the country return employees to work as safely and as quickly as possible. So over the years, we're nationwide. We've been working in this industry for 35 years. We've managed over 100,000 cases, and we've been gathering data along the way as we've done that. So we're going to take information from those cases that we've managed and show you the trends that we've seen over the last 10 years at least. We could go back 30 years, but let's look at the last 10 years because we have 30 minutes. Okay, and we're going to show you how to build those, how to look at those programs, build your data, use probability modeling to help you develop programs that can help identify where the burnouts are happening, why the burnouts are happening, who they're impacting, and what you can do about it. Okay, so I'm Jan Marie, this is Rehanna, this is Elena. We're all going to talk about this separately and then bring it all together in the end. So as I mentioned, Acclaim is a disability management company. We're Canadian. We're national. We work with the National Association of Disability Management and Research, which helps us make sure that our case managers are all employing the newest and best practices as we manage cases for employers across the country. We manage more than 30,000 claims per year. We've grown over the years. We're finding that we're supporting businesses of all sizes, from 3 employees to 30,000 employees, and a variety of different program lengths. So it could be a short-term program of 15 weeks, 17 weeks, 26 weeks, 52 weeks, 104 weeks. We manage it all. Then we hand it over to LTD providers, just to give you a bit of an idea of where this data is coming from. On average, employees are missing between 26 and 30 days per absence. Okay, so when you're thinking about the wages that your employees make, that adds up to a lot of money for each absence in a claim. That's why it's really important to know where, when, why these are happening, and how employers can impact their lost time. Okay, And then with the employers we manage over 500,000 employees a year. Okay. What we're seeing in the healthcare sector is that the average claim duration is 30 weeks. 30 days, sorry, my goodness, 30 weeks. 30 days, which is not too bad. It's 6 weeks, right? We're looking at business weeks on average for these, so 6 weeks. And we see that 7% of lost time is being saved by offering modified or graduated return to work programs. So it is really important to keep your staff engaged in the workplace to help impact that lost time, but it also impacts mental health. When you can keep people engaged, they're not at home worrying about their jobs. They're not at home looking for other places to work. They're not worrying about gossip, what people are thinking about. So if you can keep them engaged through a return to work program, we've seen the benefit of that. Of the cases that we're managing, the cases that we're talking about right now, 28% of those are mental health. If we're looking at this year, what we're seeing, it's closer to 35%. But over the years, it's averaged out to 28% being mental health. 24% are musculoskeletal. And that's common across industries. It's especially common in healthcare. We heard some conversations yesterday about musculoskeletal with patient care and so on. And we're seeing that in our numbers. In terms of demographics, the average individual who goes off work is 46 years of age. And within the healthcare sector, they average 9 years of service. I'll say that long-term care really ups that number. We have a lot longer duration of years of service, we have a lot higher average age groups. Okay, so those are trends that we're seeing regularly. We can break that down into more finite numbers for you, and then we'll build them back up again into programming. So I'm going to hand over to Rehana to show us the trends that we're seeing within mental health.
Hello, everyone. So at Acclaim, our work span the full data lifecycle, from data collection all the way to decision making. And as the Director of Data and Analytics, I have the privilege of working with a team of analysts who analyze that data so that employers could see what's happening and what they can do next. And really today we want to share some of those insights with you and discuss opportunities ahead as we continue to build a more robust, data-driven, employee-centered ecosystem. Okay. So what we've seen from our book of business within the healthcare industry, especially in the last 10 years, mental health and musculoskeletal have been the top two drivers. Mental health has increased up until 2021, and then remaining elevated but have decreased a little. Musculoskeletal have significantly fluctuated but decreased overall. In the interest of time, we'll look at some of the mental health conditions more closely. And so when we look at specific mental health categories, we see that the disorders have disorders accounts for roughly 98% of the caseload, maybe 2% the addictions. Okay. Now looking closely at addictions, we see that 52% of cases are alcohol addiction related, followed by drug addiction at 24%. And moving on to disorders, when we look at disorders on itself, by itself, 32% of cases were impacted by some sort of anxiety, followed by depression at 31%, and then adjustment disorder at 18%. So those were some of the high-risk conditions. Now let's take a look at some high-risk areas, and we'll take a look at some job titles. So our PSWs are the ones that are impacted the most, mentally and physically. And then we take a look at the generations, and we see that while our baby boomers may seem to have a handle on their mental health, their aging bodies, however, are physically impacted. Gen X seem to be equally affected both mentally and physically. And finally, when we take a look at our work-related cases, we see there were strides made in terms of policies and practices put into place to combat the musculoskeletal problems, but we must now do the exact same in terms of mental health so that we can tackle that. And now to talk about, so that was the data. Now to talk about the fun stuff, we'll hand it over to Alana to talk about some of the AI initiatives.
Just before we hand over to Alana, I just wanted to mention those are your main disorders and addictions problems that are happening. What we're also seeing is an increasing trend in more labor-impacted diagnoses. For example, the PTSD diagnoses are really increasing, and we especially are seeing this in the occupational injuries. That especially jumped when the presumptive legislation came in with WSIB. A lot more claims have been issued, a lot more claims have been approved, specifically with frontline workers working in healthcare. And so we've seen those numbers really increase. It does not outnumber what we're seeing in anxiety and depression. And anxiety and depression are strong indicators of people leading down the road to burnout, but the other large diagnosis that we're seeing taking over is the adjustment disorder. Things that happen that lead to a temporary acute disorder adjustment while people address that and for a time become cognitively impaired, they become mentally ill and can't stay in the workplace because of what's happening. And pressures in the healthcare system, COVID had a huge impact on that. And people having to work more. Less and less funding going to the nurses and the frontline workers mean that you have to work harder, you have to take larger caseloads. You're seeing more sick people who are further along in their own diagnoses in the patient population after COVID has really led to heavy workloads, heavy burden on the ability to care for people. And this is all pushing our teams into burnout, and burnout leads to absences. Sorry.
No, don't be sorry. That was great. Hi, everyone. Nice to meet you. My name's Alana Hodge. I'm the Director of Technology and Innovation at Acclaim. Case in point, this is my first time using a clicker like this, so I'm about to really use my degree. Oh, I did it. Okay. So, as you heard Ray mention, I handle sort of our AI ecosystem. She's the data expert, and I'm the one trying to get it to work very well for the organization. And Acclaim is sitting on about 30 years of data. As you can tell, I was not here when they started collecting this data. But now that I have a lot of data in my hands, we're looking to really build and develop models that not just predict risk, but also can help you mitigate it. So I can't tell you exactly what I build, because if I do, my bosses who are probably watching right now from their offices are going to kill me. But I want to talk to you about some of the data considerations and really the system design considerations that my team makes. And I have the privilege of working with these two lovely ladies here, as well as a great team of people who I think are also watching me and are hoping that I don't call them out. So thank you for attending, and then let me get started here. So a lot of us obviously are very excited about AI. I know I am. But the real question that I think everyone needs to start with before your organization even begins to go into modeling and predictive analytics the way that companies want to rush into is the main question of what do you need to consider when creating models using your data. And these questions, I think, sound very basic, but they're very impactful for your entire modeling pipeline, from not just data collection, but into insights and into actionable sort of insights later on for your users. So first of all, the real main question is, how are you collecting data? For Acclaim's purposes, I'll give you a little bit of insight. Our consultants use a case management system called ActTrack. That was a free promo of it. Thank you very much. But the questions you need to ask yourselves are, where is your data being stored? How is it being validated for accuracy? And who has access to this data? And that might be a quick, hey, it's that person down the hall that I know who has access to the database, but the real questions you have to ask here are, is your data being stored securely? Is it being stored in a way that makes sense? Is it validated for accuracy? Maybe you have a data and analytics team. I hope they're as amazing as Ray's team are. Or maybe you don't, but who has access to that data and what changes to that data can happen from the onset of collection all the way up into the modeling pipeline? So as you know, as you've probably heard other AI people tell you, models aren't actually intelligent, but people are. So we need to make sure that we account for those things early on in our data process. The second main question, and this was a very big sort of question for my team to answer, was how up-to-date is your data? And the reason I ask that is because you need to ask yourselves, what happens when your current data becomes outdated? So claims and cases in terms of employer services, short-term disability, long-term disability, all the information we gather can change daily, monthly, yearly, weekly, biweekly, whatever the situation is. And the question that you have to ask yourselves is, well, if I'm implementing a model, how often do I need this model to retrain itself? How often do I need it to consider new information that it didn't see a year ago or a week ago or yesterday? And all these sort of questions that you ask early on really drive your focus for your system design. And when I say system design, I mean from the beginning of collecting the data all the way till the end to deploying into production, as we call it. Similarly, you have to ask yourself, how do you plan to continuously develop these models? Do you have an in-house team, like we do, who are absolutely amazing? Do you have a team not working, with your company, but internally, but you have maybe contractors who are probably equally as amazing? But do you need to hire them every time your model needs updating? And figuring that out early on really sets your team up for success, I find. And finally, for this slide, anyways. What exactly are you trying to predict from your data? And we'll talk about what predictive power can mean, depending on your department, your organization, the type of data that you have. But just ask yourselves, is it the expected outcome of something? Is it a claim decision? Is it just a simple case of wanting to see a yes or no for a decision being made somewhere in your organization? And keep in mind that the simplest case of prediction, realistically, is that you've got an outcome of some sort that is some combination of useful features of data. So something that you want to predict and what can be added or contributed to that prediction. So now that I've enticed you a little bit with AI, let's talk a little bit about predictive power. So like I mentioned, I can't go into too much detail because, I'm trying to keep my job, honestly. But when we talk about predicting outcomes, claims, so far we've created models to predict claim outcomes. So, whether or not a claim is going to be approved, denied, or maybe needs more medical information. And also the claim duration. And that manifests itself as total days lost for an employee or total days lost, maybe with modified days included, that sort of thing. Now the question you ask yourself really is, what do you want your model to do for you? And so in our case, the model that we have to predict case outcome, what's that really saying? Well, it's the expected result of a claim based on the current status, right? And so that kind of feeds back into this continuous pipeline that you need to build. Your data looks good now. I've maybe collected data for the past 5 years, but what about next year when the market changes, when employers change, when employees change, when the economy changes? So that continuous development is really integral, especially in our line of work, and I imagine for you as well. I'm going to give you maybe a little bit of homework, only because I think these 4 points that I'm going to mention next are pretty important. And it's what we call the 4 pillars of modeling satisfaction. So it's sort of just these useful things to think about, to maybe check off as you're sort of thinking through these projects that you're building and as you're adapting to AI. So if I'm building a model, there are 4 things I want to be able to satisfy, not just for myself and my team, but for your auditors, for your stakeholders, for your C-suite team, whoever it might be. First one is, are you predicting risk accurately and early? So again, let's say we're predicting claim duration. I can predict it accurately, that's fine, but can I also predict when this claim is going to maybe be approved or denied before we even get to that point? Is there a risk that I can have the model predict on early on before it actually happens? And seeing if your model, or I should say designing your models to be able to accommodate for that is pretty important, and it shows that your organization can have the sort of robust insights early on. The second is, and this is a very common thing in data science, is your model explainable? And not just to yourselves as data scientists, we try to make sure we understand our work, but in general, if somebody came to you, let's say they're from the government, from a big organization, from an audit perspective, if they asked you to open up, the hood of the car, so to speak, can you explain why your model is making the predictions that it is? It doesn't have to be overly technical, but if I said to you, hey, how come this claim got denied by the model when it should have been approved? Ideally, your team should be able to go in and say, well, we see these factors, this is what the model's learned from these scenarios, this is most likely why. And that's a big thing that data scientists are trying to incorporate sort of on the daily. Thirdly, does your model actually integrate into your workflow or your business needs? Like I said, we work on a case management system called ActTrack, and as we deploy these models, the question is, do the consultants need to see the predictions at every step of the way? Is it easier, less easy to have it available versus not so available? Is it a last-minute thing? Those are considerations you make early on, ideally in your design. So you're not just building for the sake of building. It doesn't really help if your model is not helpful for your workflow. And finally, does your model enable targeted actions that actually reduce the risk? Can your model determine if the risk is a high risk versus medium versus low, or whatever your leveling factors might be? Does it make sense as an output to your consultants, your teams, your patients, your nurses, your doctors, if it's not actually enabling them to take action? Is it if something comes back as a high risk, is that a flag to your team to take an action or take a step forward? And that comes through not just data understanding, but understanding of your business processes. And finally, and I just added a few points here in case there are some other tech nerds like me in the audience, always, we go back to feature engineering, which is a fancy way of saying how do we engineer data to be useful for us. And people tend to forget that models are only as smart as the data is. Which is I find hilarious, honestly. But the questions you have to ask yourself there really is, what data are you actually gathering? Is it structured or unstructured? Meaning, is it structured data like, dates, injury types, for example, or is it unstructured like case notes or medical information, doctor's notes, that sort of thing? How are you going to incorporate that into your data? What business assumptions are you making when you incorporate this data? I could ask you a million questions, and I promise you won't have all the answers right away, and that's a good thing, because it means there's work to be done. There's a lot to talk about when it comes to building these models, not just from the data side, but from the business side, and having those conversations early is, I think, key to any modeling success. And finally, and I talk about this because I report to our Chief Information and Governance Officer, who begged me to mention the ethics of this. But when you're building models, there's bias and ethical considerations. Models are not ethical by default. Humans need to be. We need to just make sure we have that accountability. And so you have to ask your teams early, do you have data ownership and do you have consent? Do you have implied consent? Do you have consent today, but maybe not consent later? I'll give you a really good example. So as I mentioned, a claim is sitting on about 30 years worth of data. Was I around when that data was put in? No. And the better question is, 30 years ago, let's say back in 1999, if somebody gave their consent for their data to be used, does it imply that that data should still be used in 2025? This sounds very terrible to say, but a couple decades ago, did people give consent knowing that their data would be used to train AI models in the future? Probably not. Mostly because, we weren't expecting the year 2000, for example. So do you have consent for your data now, and when does that consent end, or when is there a line to be drawn? Also, we always consider our legislative regulations. We're bound by PIPEDA. I hope that most of you are as well. If you're not, please don't raise your hand. But are your tools that you're using, not just your data and not just how you're building the models, but are your tools compliant? There's tons of AI tools out there. You can look at LinkedIn whenever you want, and somebody will offer you a new one. But will the data stay in Canada if you use that tool? Those are questions and considerations we make very early on. And finally, and this is for my parting note, just always remember that every department, every organization, every group of individuals has different goals and outcomes and wishes when it comes to modeling in particular. Employer services, when we talk about the cases we see, we have short-term disability, long-term disability. There's different predictive goals that we might have just based on the context of the scenario. So having those discussions early, whether that means deciding on making a bunch of smaller models to feed into one larger model or one giant model to make smaller decisions, kind of helps you avoid trying to make one solution that fits everyone. Our philosophy really is you design small and start small and be prepared to scale big as you learn more and develop more. But that sort of allows you to, what we say in the business is, allows you to fail fast and fail early on so you can make those considerations and change without impacting your entire business. And so far, I have not impacted the entire business. I've impacted only in a positive way, I hope.
Absolutely.
Excellent. Anyways, with that, thank you very much. I'll pass it back to Jean-Marie.
So to wrap this all up in a nice bow for you, how are we going to avoid burnout? That was exhausting for me. I feel a bit burnt out because I am not a data tech person. But I appreciate what we get from them. And I think one of the takeaways from this is if you're not collecting data, start. You can start with, I wouldn't say a piece of scrap paper, but start with an Excel document and figure out what you need to track, what you want to track, what's important to the business, and grow from there. If you're managing your claims in-house, you might have a software that you're using. I know a favorite of hospitals is Park Lane. I've used it. I know the challenges. But there is data that you can pull out of there. If you're working with a third-party provider who's managing your absences for you, either an insured product or a self-insured salary continuance program, they collect your data for you. So what can they give you to build on? What answers are they giving you? Tell them to tell you where the impact is on the business with your mental health. We collect a lot of different data to help us determine that, down to even if the employee has said that the workplace is having an impact on their well-being, whether it's physical or mental, right? So we make sure we track that as well. So how can you use your data to reduce the workplace impact on employee well-being? That's the $20 million question, and really it's closer to a $650 million question these days for larger organizations, but it is literally dollars and cents that's impacting your business. You need to figure out your data first of all, and then how do you translate your data into actionable workforce strategies? And part of that is, where are the mental health cases coming from in your business? Is there a particular department? How deep can you drill down on that? Is it a particular department? Is it a particular location? Is there a particular supervisor? Or is there a change happening somewhere and we're seeing an impact on that? Very often, if you're reorganizing something, we as case managers see an influx of mental health cases just from the uncertainty. So change management programs within your organization when you're making changes is hugely important. Don't underestimate the power of having change management specialists walking your employees and your management through those steps, because that is one area that has a great impact. If there's rumors of job loss, your staff are they're the ears on the ground. They know everything, and they're sharing that. So secrets aren't secrets in organizations, big and small. Address those concerns and tackle them. That's point number one. And when you're looking for trends as well, look for other things that might be happening. There may be, when you're looking in a hospital, what we often see is a patient area. In one patient area in particular has a larger impact. Who are the patients in that area? How are they interacting with staff? Who are the staff going in there? Is there someone in the staff that's having challenges and it's impacting other people? So your managers, your supervisors are information sources there. So looking for those solutions. How do you resolve those? Your first step is understanding what's going on. So understand your data. Use your predictive models to see where those things might future occur. If you're seeing an uptick in a department, that uptick's not going to stop itself. Something needs to be done. But if you're seeing another group just going along swimmingly, let's see what they're doing and how that might be able to be replicated somewhere else. So those trends are important to understand. Understanding your workforce too. Do your staff have access to care, and how are they accessing that care? Are they accessing that care? If you've got benefits programs, ask your benefits providers to tell you how the paramedicals are being used. Are they all being used? Is anyone using the mental health supports? What types of medications are people on? They may not be off work, but you may have a lot of people who are doing their best to stay at work. They may be in different types of treatments, and you want to know that. I see it. We have a minute. So the next step is, once you have your data, you know your data, do something about it. Can be as simple as looking at the programming you have available through your paramedicals and educating staff on it. Could be having, you have a large population of healthcare providers within your organizations, could be having those people talk to the staff that are off and providing them guidance on where they can go for help. A lot of times when you're sick, you don't have the wherewithal to do that. So really looking at what you have, think outside the box, create new programs. As I said at the beginning, absence rates and workplace impact associated with mental health are increasing. Employers have the tools in their toolbox to help reduce that impact. It's important to get it, use the data you have, start looking at predictability, and start getting in front of those programs to be able to support your team. Okay. Any questions? Yeah.
My question is, when I was operational, the P word was always there. So I don't know what that employee is off with. And so there was no way for us operationally to address whatever it is that's causing that person to be absent. So if this data is available to occupational health in most hospitals, I don't know about yours, but for ours, it was a black box. So it was like, we can't ask why that employee was away. They have a legitimate reason. They're going to be back with accommodations, you know. So I'm just wondering who would access that data in the healthcare organizations.
So if your absences are being managed in the health and safety, the OC Health Department, and I've worked in the OC Health Department in hospitals, whoever's running that group should be organizing the data on that, should be able to tell you where those numbers are and what is being done. So those are your gatekeepers there. So in my experience, occupational health and safety are amazing at occupational health and safety. They aren't necessarily the people that know how to do this stuff. So there may be training needed. There may be somebody who might need to come in from outside. I find a lot of times HR is really good at numbers and good at helping. Payroll, you know, tap into your departments that have the expertise to be able to get something started, to template, if it's going to be a spreadsheet, template that. Stats decks, template those, and then the data can flow fairly easily. Well, I say that because I have Rehana to do it for me, but once you get a start, that information is it's housed there already. I will also say that your health and safety people know exactly where the trends are and what's happening, and so asking them the right questions using the predictive guides that Alana provided, a lot of those questions can be asked of those gatekeepers, and they may not know it, that they have the information in their head, but if you ask the right questions, they'll be able to figure it out and give you a lot of good guidance.
Thank you very much.
You're welcome. Thanks, everyone.
Thank you.